In women's health, there's a very common condition, but one that often causes anxiety just by its name: Polycystic Ovary Syndrome, or PCOS for short. It's seen in about 10 to 15% of women of childbearing age, so it's actually more common than we might think. PCOS affects ovulation patterns and hormonal balances. This can complicate both daily life and the process of becoming a mother. The symptoms aren't the same for every woman. Sometimes they're very mild, other times more pronounced. The most common symptoms are menstrual irregularities or no periods at all, ovulation problems, and, as a result, difficulty getting pregnant, weight gain and insulin resistance, unwanted body hair growth, acne, meaning pimples, and oily skin. But the issue isn't just cosmetic. In the long term, PCOS can also pave the way for serious health problems like diabetes, hypertension, and metabolic syndrome. When making a diagnosis, we don't rely solely on ultrasound images. We also examine hormone levels through blood tests. And most importantly, every woman's PCOS profile is different. That's why, in treatment, instead of applying the same prescription to everyone, it's necessary to draw a personalized roadmap. First, lifestyle changes, meaning diet, exercise, and weight control. If necessary, using medications to regulate the menstrual cycle or reduce insulin resistance. For women who want to conceive, treatments that stimulate ovulation. In more advanced stages, reproductive technologies like IVF. The most important thing I've seen over the years is this: when PCOS is managed correctly, it's possible to achieve very positive outcomes for both women's health and fertility. In fact, seeing many of our patients overcome this process step by step and become healthy mothers is one of the greatest joys for us as doctors. Remember, PCOS doesn't have to take control of your life. Proper follow-up and treatment increase your chances for both a healthy life and for becoming a mother.